I will show you some of the common equipment used for patient care which you will be using in your day-to-day activities, in your routine work. So, first I will show you taking of vital signs of the patient, that is, you need to take blood pressure of the patient by using this device. This is called digital blood pressure instrument. It has a monitor, it has a cuff which can be applied on the arm, and the display screen gives the value of the blood pressure. Then there is another machine you will come across. This is called aneroid blood pressure instrument. In this has a dial. When you put the cuff on the patient's arm, you will get the reading on this dial. So, this also help you to take the blood pressure of the patient. Then in vital signs, another thing which we make use of is the taking of temperature of a patient. This is a digital thermometer. Before use, it has to be cleaned with the spirit swab, and you see the reading, that make sure it is on. There is an on button, and then you take the temperature of the patient, and then after a beep you remove and check the reading. Then while taking blood pressure, you need stethoscope also. This is stethoscope which has earpiece. These are earpieces, and this has diaphragm. So, this is used to check palpate the pulse and then check the blood pressure with the help of the instrument which I have just told. Then sometimes the patients have problem in breathing. We make use of certain things. This instrument is called as AMBU's bag, AMBU, artificial mechanical breathing unit. So, this is placed on the patient's nose, and then this bulb is compressed to give the patient the definite volume of air inside the lungs for taking care of the breathing. And sometimes we need to attach the patient to the oxygen source, oxygen cylinder, and we make use of this kind of mask which is available in the hospitals, and this end is attached to the oxygen source, and this mask fits on the patient's face. And it also has another attachment here which can be opened up. Those patients who have a breathing problem, asthma problem, they are ordered some medications that is put in this cup, and it is closed. It is called nebulization, and the patient is attached to the oxygen source, and the required amount of the medicine goes through the inhalation. The person inhales by way of putting the mask on the patient's nose. Then those patients who have problem with the airway, either airway obstruction, we make use of artificial airway. One of the airway is called endotracheal tube. This is endotracheal tube. This has a balloon at its tip, and it has a port here. When we introduce air from here, after introducing into the trachea, this gets inflated. The main purpose of putting this endotracheal tube is so that it does not come out. It remains, it fits snugly there, it does not come out. So, this goes into the trachea and then attached either to the ventilator or to the oxygen source. And this is ordinary oxygen catheter. When we have to give a patient only oxygen which is attached to the oxygen source, that is oxygen cylinder. Sometimes we need to do the suctioning of a patient who has plenty of secretions in the respiratory tract. So, we make use of this catheter and attach it to the suction machine and then do the suctioning of the airway to get rid of the secretions and easy breathing. Some patients need to be given intravenous fluids, that is IV fluids. Those patients who are not taking by mouth or whose surgery is done or by way, they have to be given intravenous fluid. So, this goes to the source, that is the fluid which is to be, this is intravenous fluid set, IV fluid set. This goes inside the bottle and this is the regulator drip set by which we regulate the flow of the fluid. And this is the Y port. Here we can see here you can introduce any other fluid also along with this, sometimes even medications, which other medications which are ordered along with the IV fluid, that can also be given. And this goes to the patient's vein, blood vessel, with the help of a needle. So, this is IV set, intravenous infusion set. Sometimes the patient is unconscious or tongue may fall back, which blocks the air passage. So, to keep it open, we make use of different kinds of airway. This is one type of airway which goes inside the mouth and it is hollow and we can even suction it from here. This is another type of airway. These are all plastic ones, PVC ones. This is the one with the metal. So, you have different kinds of airway. This is the tracheostomy tube which can be placed in the trachea. Again, the patients who have problem with the breathing or there is a blockage or when you want to remove the secretions from the respiratory passage. So, from one end we can do the suctioning and by this we can keep the airway patent. Then we have certain appliances. When the patient's temperature goes high, we need to bring down the patient's temperature. We make use of this. This is called ice cap. This can be opened from top and we can put ice cubes in it and close it, and we can put this on the patient's head in case of fever. And sometimes we make use of this. This is also device to reduce the fever. This is called ice collar. In this also ice cubes can be put from here and it can be tied on the patient's neck. That is why it is called ice collar. And then to keep the patient warm, we have hot water bag. This is the urinary catheter, indwelling urinary catheter, which is called Foley's catheter. Patients who have problem with the retention of urine or incontinence, we use this catheter. This has two ports. One goes to the one is attached to the drainage urinary bag. Another port is used to inflate a bulb which is there near the tip. This is the bulb. So, when we introduce fluid from this port, this gets inflated after insertion. So, it does not come out. So, that is why it retains in the urethra. So, it does not come out. So, we can keep this catheter safely for few days. This tube, we call it as Levine's tube. This is introduced through nose into the stomach for either feeding or for removal of gastric fluid in cases of gastric suction. There is another tube used for the same purpose. This is called Ryle's tube. It has a metallic tip at its end. So, this is also introduced through nose, and this also goes into the stomach, and due to the gravity, because this has a metal tip, it remains there only. There are least chances of coming up and getting dislodged. So, this can be used for either feeding purpose, those who cannot take themselves by mouth, or for suctioning. This is the syringe. The various parts of the syringe are this is called barrel, this portion is called barrel, which has markings to tell you about how many milliliters, and this is called piston. When we can move this up and down while giving injection, and this is called the tip of the syringe, and this is the needle. This is the called shaft of the needle. This portion is called the bevel of the needle. The tip is called bevel, and this is called the hub. Then we make use of inhaler for patients who have who have lots of secretions in the respiratory tract, to get rid of those secretions. So, we give them inhalation. This kind of inhaler is called Nelson's inhaler. This is spout, and this is mouthpiece, through which the person takes in the steam and exhale through the nose. And when we give to the patient, we remove the cotton from this. So, the air enters from here and the steam moves up and the patient takes the steam. So, it is mainly for steam inhalation purpose. Sometimes we even add some medication in it to give medicated steam inhalation. This is waste receptacle or kidney tray, which is used to receive the waste. So, we can use for throwing off the waste. Very useful in doing any procedure. Waterproof cover, or we call it as Macintosh, to keep the linen from soiling. So, we place this, over that we can place a towel, and we can make use of this waterproof cover. Sometimes the patient cannot open the mouth, so we make use of this device, which is called tongue spatula. So, we can use this to depress the tongue and view the interior of the stomach, interior of the mouth. And if this metal one is not available, you can make use of ordinary this kind of spatula. Sometimes patient is not able to open the mouth, or while giving mouth care, we make use of this device, which is called mouth gag. So, this can be opened by putting this in the mouth and closing it. This gets closed and this gets opened like this. We can open the mouth and give the mouth care. We also make use of torch wherever it is required to view the interior of any of the body cavity. Then, to handle the sterile supply, this particular forceps, which is called Chittle's forceps, is used to which is sterile, to remove the sterile supplies from the container and transfer or give it to the person who has to use the sterile supplies. This is called thumb forceps. This is again for handling the sterile things by making use of thumb forceps. This is sponge holding forceps. This is used for cleaning, at times to clean the wound, or sometimes if artery clamp is not available, we use even this forceps to clean the site. This is another type of tracheostomy tube, which is metallic. It has inner cannula and outer cannula. Inner cannula can be removed, cleaned, and then can be inserted again, and can be, this type of tracheostomy tubes can be reused, they are not disposable ones. Then a very common instrument which is used is artery clamp. It looks like this. It has a locking system by which you can close it and have a better grip, even for giving mouth care, for doing the dressings, by using gauze piece, which can be used. Then this is called Sims speculum. This is used along with this along with this instrument, which is called valsalum speculum, or it is also called as cuscoscope, which is used for vaginal examination. By this, the vaginal wall is retracted and this is introduced, and while introduction it is introduced in this way and then it is opened, and the doctor can view from the interior of the cervix from the other end. This we had told you about the Foley's catheter, indwelling catheter, which needs to be attached to the, this is called urobag. Urobag, this has again graduations by which the urine output can be measured, how much urine the person has in particular day or particular hours. It can be emptied and it can be measured. This is urobag. This particular machine is called nebulizer. For this we do not need oxygen source. It has we attach this tubing with this, and then we attach the mask which I have just shown you earlier, and this is attached to the patient, and the medications can be added into this cup which is their nebulizing cup, and patient can be given. And this can be, it is electrical inhaler nebulizing machine which can be put in the electrical outlet, and patient by way of by use of this mask can get the required amount of medications, those especially those who are asthmatic patients, very useful for them. This is very common device which is called splint, where when you want to immobilize the joint for giving intravenous fluids so that the person does not move, otherwise the fluid will not go in the vein. So, to immobilize the part we make use of this kind of device which is called splint.